At the outset, I can begin. At the outset, I would like to thank SAGES to giving us an opportunity to present our data here. I would also like to thank the moderators, Dr. Rosenthal and Dr. Behrens, and the audience present for the kind attention. I have no disclosures to make. We all know dysphagia is a symptom which has a severe impact on the quality of life of an individual who has it. It's not only a challenge for a physician to diagnose dysphagia, but in fact a bigger challenge to manage it. Dysphagia has been classified into obstructive and non-obstructive forms. Talking about non-obstructive dysphagia, the workup pretty much includes an upper scope, upper GI series, but esophageal manometry has been regarded as a gold standard investigation. Recent studies also suggest that esophageal function testing is a more sensitive tool of assessing esophageal function. So what is EFT? EFT actually includes standard manometry along with a multi-channel interluminal impedance. And what impedance is, it stands for opposition or resistance to current. And talking in context of esophagus, it actually relates with electrical conductivity of esophageal wall and its contents. Like here we see, if a bolus is present, which makes presence of more ions, results in lower impedance, or else vice versa. This is a spectrum of impedance showing as impedance changes with the type of bolus present, with impedance being minimum for refluxate and maximum for air. This is a manometry and impedance catheter that we used. This one.
You like the other one?
This one is not working. Which we use for our study, and we can see the impedance sensors with pressure sensors positioned. This is how the normal impedance and manometry tracings look like on analysis. Coming on to the aim, our aim of the study was to objectively categorize subjective sensation of dysphagia using esophageal function testing. We included 139 consecutive patients between July 2008 and June 2009. This was a retrospective analysis of prospectively collected data. All these studies were performed at Esophageal Physiology Lab at University Hospital's Case Medical Center in Cleveland. For the purpose of EFT, the patients were asked to take 10 liquid swallows and 10 viscous swallows. For the purpose of liquid swallows, we used normal saline, which is pretty much standard. And for viscous swallows, we used EFT viscous supplied by the industry. Apart from this, the patients were also asked to report if they had a stuck feeling during any of these swallows, which was actually noted down by a nurse on a swallow chart. And during the analysis, we further saw and compared them. For the purpose of data collection, we collected following parameters, especially the diagnosis, manometric, and impedance in terms of incomplete bolus transit. This is how we defined our bolus entry, where the impedance fell down below 50% of the baseline, and then we defined our bolus exit when it rose again beyond 50% of the baseline. A total of 139 patients with 2,780 swallows were evaluated, equally distributed 1,390 swallows in liquid and viscous groups. Majority of the patients in our study were females with an average age of approximately 54 years. The most common symptom was heartburn, although the next biggest group was dysphagia, which had 65 patients in it. Manometric results showed majority of the patients to have normal peristalsis. The next biggest group was actually achalasia, which had 12 patients in it. Interestingly, when we analyzed every swallow, we found that 12% of these swallows had abnormal manometric findings. On the other hand, 44% of these swallows had incomplete bolus transit on impedance studies, which was a big difference. We also analyzed stuck feeling, as I told, and we found 8% of the liquid swallows and 14% of the viscous swallows were reported to have stuck feeling by the patients. The patients were then divided into two groups, dysphagia group, which had 65 patients, no dysphagia group, which had 74 patients. Results were then analyzed in terms of bolus transit and stuck feeling. So we found that patients in dysphagia group actually had significantly higher incidence of incomplete bolus transit as compared to individuals in no dysphagia group. Secondly, we found that individuals in dysphagia group had a higher incidence of stuck feeling, significantly higher incidence of stuck feeling as individuals in no dysphagia group. Interestingly, we found that this stuck feeling was much more experienced for viscous swallows in both these groups, almost twice as in liquid swallows. And we found, finally, that 40% of the swallows in the dysphagia group, which were liquid swallows actually, had incomplete bolus transit and had stuck feeling. For the 60%, almost 60% of the viscous swallows which had incomplete bolus transit were associated with stuck feeling, which was significantly different than in the group which had no dysphagia. Interestingly, another thing, 34% of both liquid and viscous swallows in dysphagia group which had a stuck feeling, they actually have normal bolus transit. And more than 50% of both liquid and viscous swallows in no dysphagia group which had stuck feeling had normal bolus transit. Summarizing our results, the patients with primary complaint of dysphagia sense a stuck feeling with incomplete bolus transit more often than individuals who do not have dysphagia as primary complaint. Those without dysphagia did not complain of a stuck feeling with incomplete bolus transit majority of the times. To conclude, dysphagia has a high subjective element, as all our swallows which had a stuck feeling did not necessarily mean incomplete bolus transit. But our study did demonstrate a strong symptom correlation of stuck feeling with incomplete bolus transit in individuals who had dysphagia. Meaning thereby the patients with primary complaint of dysphagia are more likely to appreciate incomplete esophageal clearance than those who do not have dysphagia. Just to conclude, this is the hand of my first newborn baby, and I thank my wife for it. And this year again, this is my first SAGES presentation, so I thank SAGES and the moderators. Thank you, everybody.
Very nice.